goodness.
Hosted by Senator Novell E. Francis Jr., Vice President of the 34th Legislature and Chair of the Committee on Health, Hospitals, and Human Services. I am Shauna Richards, and I'll be moderating tonight's town hall. Thank you so much for joining us and for being part of this conversation. Tonight, we have an exciting array of panelists representing local organizations that provide services and care in the behavioral health space. And I'd like to welcome from Island Therapy Solutions, Dr. Lindsay Wagner, Dr. Rita Grant, Dr. Sophia Parija, from NAMI, the National Alliance of Mental Illness, St. Croix Chapter, Ms. Sherilyn Poxon, from 10,000 Helpers, Mr. Malik Stradiron, from the Disability Rights Center of the Virgin Islands, Ms. Amelia Healy Lamont, from Catholic Charities of the Virgin Islands, Andrea Shillingford, Ms. Andrea Shillingford, and from the Virgin Islands Partners in Recovery, or the Village, Ms. Marcia Taylor and Ms. Mondia John Baptiste. In a moment, I'll turn the town hall over to Senator Francis for some opening remarks.
Hello?
But first, I'd like to explain tonight's format. After Senator Francis's intro, we'll have introductions from our panelists, followed by the discussion with our panelists. And after that, we'll open the floor to the question and answer portion of the town hall. Questions can be posted on Facebook or in the chat. And now I'm going to turn it over to Senator Francis.
Thank you very much. I'm Ms. Shauna Richards, Chief of Staff, and good evening to the Virgin Islands community. I want to say a pleasant good evening to all of our panelists that have joined us this evening for this very, very excited and much-needed discussion as we talk about mental health. We had an opportunity to vet the governor proposed legislation on the Comprehensive Reform and Behavioral Health and Developmental Disability Act on February 26th. And at that hearing, we had the Department of Health, we had the Department of Human Services, the Virgin Islands Police Department, the Attorney General's Office of the Department of Justice. We certainly had a representative from NAMI. We had the Virgin Islands Bar Association, Office of the Territorial Public Defender's Office, and Judge Willocks representing the Superior Court of the Virgin Islands, and really just represented himself and all of the issues that he have discussed in regards to being a strong advocate for mental health awareness. At that committee meeting, again, we heard some of the technical issues regarding our mental health and behavioral health issue. This evening, I'm hoping to shift gear a little bit. I'm hoping that we could really start to hear from some of our stakeholders and those individuals within our community, and really afford our community an opportunity to really weigh in and have a discussion in respect to some of the issues, the mechanics, some of the things that they're confronted with on an everyday basis, family members, and the fact that the difficulties or challenges that they're experiencing when they call the Virgin Islands Police Department or they make a phone call to EMS, and just really talk about how do we address those particular issues, hearing from our community. We continue to vet the measure that has been sent down by the Honorable Governor Albert Bryan in regards to the comprehensive reform, and I just wanted to just speak quickly about some takeaways and in terms of that particular proposed legislation. Of course, we were able to kind of just divide it up into 5 categories. We found that the bill seeks to provide a much-needed overhaul and expansion on the services for individuals with mental health and or developmental health concerns under the umbrella of behavioral health. It seeks to provide for an assessment, treatment, and protection of persons who suffer from behavioral health challenges, mental health disorders, intellectual or developmental disabilities, alcoholism, and drug dependency. The bill mandates for the construction and operation of a behavioral health facility and provides clarity of the responsibility for first responders and really mandate training for our law enforcement agency. And 5th, the bill also seeks to coordinate the work and services of advocacy organizations with various governmental agencies and departments. So this evening, we'll continue to vet that particular legislation, but outside of that, I really truly want to hear from the stakeholders and just have a discussion in respect to some of the challenges that they're experiencing and how best we will be able to meet the needs of this community in regards to behavioral health, mental health. Talk a little bit about the stigma and work a way around the stigma, but more importantly, try to navigate the process by which we'll render services as a government entity to our community. So as we develop this legislation, it's critical that at the end of the day, we're able to meet the needs of our community in so doing. So I look forward to a robust discussion this evening. Certainly we'll hear from the stakeholders that's on the line, and then we'll come back and really have a discussion in regards to some of the concerns, issues, challenges, and more importantly, how do we meet the needs of our community. Thank you very much, Ms. Richards, for the introduction, and I look forward to our robust and lively discussion in regards to Let's Talk Mental Health.
Thank you, Senator. So now we will have introductions from our panelists so that our community gets to know exactly who we're going to be hearing from tonight. We'll start with Island Therapy Solutions.
Hi, good evening. Thank you for having us this evening. We are unable to hear exactly what you guys were saying there. I don't know if anybody else is able to hear.
Okay, so Senator Francis just gave his introduction. We were having some technical issues with audio, but we're working on straightening those out. But we just are at the segment of our program where we're asking the panelists to all introduce themselves so the community knows exactly who we're hearing from tonight.
Okay. So I'm Dr. Lindsay Wagner. I am the owner and CEO of Island Therapy Solutions. I'm a pediatric neuropsychologist here on Island. And to the right of me is Dr. Rita Grant, who is our community liaison coordinator and also a psychologist here at Island Therapy Solutions. And to the left of me is Dr. Sophia Parisia, and she is our clinical coordinator and also a psychologist here at Island Therapy Solutions.
Thank you for joining us this evening. Next, Ms. Sherilyn Pogson of NAMI.
Hello, good evening. My name is Sherilyn Pogson, and I am the president of the National Alliance on Mental Illness St. Croix affiliate. And NAMI St. Croix is is a group of dedicated volunteers that we work to raise awareness and provide essential education, advocacy, and support group programs for persons in our Virgin Islands community that's living with mental illness and their loved ones.
Thank you so much. Ms. Andrea Shillingford, Catholic Charities. Ms. Shillingford? You need to unmute yourself. Ms. Shillingford, you are on mute. Okay, we will move on to Ms. Lamont, Disability Rights Center, and come back to Ms.
Good evening.
Shillingford.
Can you hear me?
Yes, we can.
Great. Okay. Good afternoon or good evening. My name is Amelia Headley Lamont. I'm the director of the Disability Rights Center of the Virgin Islands. The Disability Rights Center is what's referred to as the protection and advocacy organization for the U.S. Virgin Islands. Our work is primarily legally based. It was founded in 1977 and it evolved under a variety of names. Our work having to do with respect to individuals with mental illness is we have an advisory council that provides us with guidance on what steps that need to be taken, whether it's litigation or advocacy, and outreach with regard to mental health. And we can at some point talk about a class action lawsuit that we brought back in 2003 and had shepherded up until 2014, up to the present time. Just to give everyone present, and particularly Senator Francis's office, just a context as to the length and breadth of our involvement in this regard.
Thank you. And we will now hear from the VI Partners in Recovery.
Good evening. I'm Marsha Taylor. I'm the regional director here at the Village, as everyone knows us as. We are a residential substance abuse center, and we also do some outpatient services. We do co-occurring disorders as well, because it does come, mental health, substance abuse does come hand in hand. So to my right, I have Mariana John Baptiste, and she's one of our therapists here. And that's us, the Village.
Welcome. And now we will go to Mr. Malik Stradiran for 10,000 Helpers.
Good evening. Can you hear me?
Yes, we can.
All right. Good evening. My name is Malik Stradiran. I'm the Executive Director for 10,000 Helpers of St. Croix, Inc. We're a nonprofit agency that deals with the mentally ill males who are homeless and may or may not have substance abuse issues. We have residential housing programs, and we also do street outreach, and we're located in Frederiksted, number 61 in Hospital Street.
Thank you. And now we are going to circle back to Ms. Andrea Shillingford, Catholic Charities of the Virgin Islands.
Good evening, everyone. Can you hear me?
Yes, we can.
Yes. Okay, I'm Andrea Shillingford, Executive Director of Catholic Charities of the Virgin Islands. We at Catholic Charities, we are not a mental health facility. We do not provide mental health services. Our role is to provide services to the mentally ill. We do administer the PATH program for assistance in program for assistance in transition from homelessness, which is a SAMHSA program. That program allows us to provide outreach services to the mentally ill, to the street homeless mentally ill. And what we do is do intake on all the clients, and then we would make referrals to whatever services they require.
Thank you. So we've gotten the introductions from all of our panelists, and now we're going to move into the discussion portion of our town hall, where we will direct questions to our panelists, and everyone can have an opportunity to jump in and answer. But our first question tonight is, I'm going to direct this to Ms. Lamont, and then anyone else can jump in. In providing behavioral services, what is the current level of collaboration between nonprofits and government entities?
I think the best example of collaboration has been what has been occurring over the years. As I mentioned before, our organization has an arm of individuals whose sole focus is mental health, mental illness in the territory. It's what we refer to as the Protection and Advocacy for Individuals with Mental Illness Advisory Council. And that council over the many years has provided us with guidance as to what are the pitfalls and gaps in the delivery of mental health services. So as such, back in 2003, we, with their, advice, brought a class action lawsuit against the government, Department of Health, and those entities that are charged with delivering mental health services. And as a result of those many years, and first of all, let me just say this lawsuit came as a result of a report that was brought by a national technical assistance group that studied the Virgin Islands, and this was at the behest of an individual who was at the time head of the Division of Mental Health, Mr. Millen, Dr. Millen, I believe. And so he invited a group to come and look at us objectively and see what our problems were, and he came up with 4 or 5 points. One was that we are very deficient in delivering, coordinating, and integrating amongst ourselves services, mental health services. The other was that we're not very good at sticking to requirements that, the federal government, if we're getting monies from the feds, we're not very good at following through on what they're requiring us to do when it comes to reporting, accounting, whatever. We also are very deficient in attracting qualified staff. And one of the things we hear repeatedly is that we don't have appropriate resources to pay qualified psychiatrists, psychologists, and the like. As a territory, we're not able to finance programs, and we don't have apparently the ability to really project for the future. So over the years, we've been collaborating, thankfully, with the members of NAMI, who has been very instrumental in giving us some guidance and feedback as to what needs to be done. I mean, our role is as a nonprofit. Again, we're legally based. We are not direct service providers in the sense that we're not, caseworkers per se in a social work vein. So our avenue is the courts. Our avenue is providing information to the community. Our office, particularly Attorney Jennings from our office, has worked with a behavioral coalition where we get input from individuals throughout the community, direct service providers, and the like. There's a lot of, I think, collaboration. The challenge has been for us, seeing over a period of years when there's a change in administration, we have different people who are in leadership, and so it's back to square one. So it's not that we can't accomplish things if we work together, it's just trying to maintain a consistent commitment. And that has changed over the years, regrettably. Every 4 years, we have to say, okay, where are we? Do we start over again or, re-educate and the like? So we've been at this, I can say, since 2000, 20 years. And the issues haven't changed. And we're spending an awful lot of money for services off island. We're spending tens of millions of dollars to provide services to persons with mental illness that can be done right here. So that's my 2 cents. I don't want to talk too much.
NAMI, Ms. Poxon, is there anything you want to add to this?
Yes, actually, yes, I echo some of the concerns that Attorney Hedley Lamont has voiced. I do think that there is collaboration, and as she said, we have many community stakeholders. We've all been doing this for quite some time, some longer than others. So the collaboration does exist. just the consistency, of course, is what we need to make sure that we work on, and the communication aspect of it. I know that's a challenge, especially now during the current times because we're dealing with a pandemic. But these issues did exist prior to the pandemic, so we just need to work just a little bit harder to make sure that we get past it, simply because we have to. We're in the middle of a crisis, and so we have to. So one of the things that NAMI Syncoi, we want to make sure that we have started to, we've begun the work. There's still a whole lot of work to be done, but we have begun the work to reach out to faith-based leaders, other nonprofits, to really try to be a good convener, so we can come together and really try to see how we can manage the resources that we do have. So that's what I would say. We definitely need to do some work, but we're limping along, but we're getting there.
Okay. So our next question. Okay, sorry, Senator Francis is going to.
I think that's a perfect segue for us to have a discussion in respect to, as a legislative body, and several of my colleagues have joined me in this particular call and this town hall, and I just wanted to, consistent commitment is something that's critical and very much necessary. So as a legislative body, how would you implore or encourage us to close that loophole by which you continue to discuss the changes that occur for every 4 years? How do we allow for some consistency across administration, so in fact we're able to continue to address the needs of the community? Attorney Lamont, would you like to weigh in, and how do we close that loophole, or that gap that you have recognized that continued to plague us for quite some time?
That's a great question. And I do recall at the hearing late February on this very issue. And first of all, I want to commend you, Senator Francis, for raising this. I really appreciate that. I think you'd be to be commended for that. I do recall one of your colleagues saying that we as a community need to have a stronger knowledge of civics. And that's not only here in the Virgin Islands, it's across the United States. People just don't understand the role of the legislature, the role of the executive branch, and the role of the judiciary branch. I think perhaps if there's a way in which the executive branch, we can hold the executive branch's feet to the fire, because they're the ones who are supposed to execute the laws. One of the things I noticed, which was a pleasant surprise to me, is that in the books there's already I believe it was a citizens patrol. That, granted, it's an uncompensated patrol, and that's something the legislature could fix. But it's set up so that people in the community can go out and look for people who are in crisis. All right. Now, maybe that needs to be looked at and made current so that there's nothing to run afoul of somebody's, rights, or if any injuries takes place. But there are laws in the books that it's there. And so my whole point of what needs to be brought out is we need to hold the feet to the fire of the executive branch. You can pass all the laws in the world, but if no one is going to implement them, we have a problem. So, our role, NAMI's role, and a number of those of you who are here, is to educate the public, to keep this issue, and just hold the executive branch's feet to the fire. Ask questions of commissioners. What is being done with respect to this issue? I was surprised where I believe it was Commissioner or Deputy Commissioner Steele said that nothing was happening, or that the Annis Hope property is not feasible. That was shocking to me, because I know many years was spent looking at the Annis Hope property as a possible location. We probably need to revisit that. Perhaps it's not. Maybe it was appropriate 20 years ago, but now it may not fit the bill, for the purposes that, there may be even a change in what we want to use that property for. Okay, the whole notion of residential facilities is we're not trying to go back. We don't want to go back to warehousing people. We want to integrate. The Supreme Court has said, integrate persons with disabilities to the greatest extent possible. Don't, shove people away in a corner where, God knows what kind of, possibility of abuse could occur. So, Senator, I mean, that's an excellent question. I think a lot of it has to do with educating the public as to, look, my role as a senator is to pass laws, appropriate monies, but the entity that is supposed to execute what I've passed is the executive branch.
Is there anyone else who wants to weigh in on this topic?
Yeah, this is Sheila. Can you hear me, Shauna Richards?
Yes, I can. But Sheila, we're not yet to the question and answer period for the public. So from our panelists, is there anyone else who wants to weigh in on this question, on this topic? Okay, so we're going to move on to our next question. Dr. Rita Dudley Grant, I see you have your hand up. You'd like to weigh in? Go ahead. You're muted. You need to unmute.
Okay. Yeah, ways to save money. I think one of the things that we have talked over and over again, and I agree with everything that has been said, is the need to move direct service out of government. And just as Attorney Hedley Lamont said, what you do is let government serve as that oversight function, making sure that the laws are being followed. But there is much more flexibility when direct care is provided through the private sector. There is more access to even, say, insurance funds, because the government can't bill insurance, but private sector can. And that would definitely double the amount of resources that are available. I agree 100% that we need to bring people home. But in bringing people home, we have to have places for them to stay. The whole range of places, from acute care to long-term stabilization to independent living. There's another big challenge that we need to get to, and that's accessing the SSI funds, the Social Security funds. Those are changes that I'm hoping that our delegate will be able to take the lead with this much more responsive government. So there are resources on the federal level, there are resources in the private sector that we are not accessing. And if we did that, we would be far better off to provide the range of services that we need.
Thank you all. So we're going to move on to our next question, and we're going to talk about access to quality mental health care. So many people in our community don't have access to quality mental health care. What steps are we taking, and can we take, to bring quality mental health care to make it more accessible throughout our community? So I want to direct that question to Island Therapy Solutions. If you could just weigh in on that question.
Can you repeat that? We're not able to hear very well.
So the question is about giving access to quality mental health care in our community, recognizing that many people simply don't have access. So what steps are we taking, and can we take, to bring quality mental health care to our community?
So one of the things that at Island Therapy Solutions I can speak to here that we've been doing, but we have been collaborating a lot with different government agencies and working on getting a lot of different contracts set up with different entities so that we can be serving all of the different areas of need. We've been hiring a lot of different disciplines and doing a lot of training with our students here on the island at UVI, and bringing on interns to training people here locally in order for them to learn the skill set. We also need to get so that all of our mental health providers are able to take MAP insurance. That's one big step that we've been doing at ITS, is we've started taking MAP, which has increased the number of people that we're able to reach and give services to. That's been very, very helpful. And then also, creating more licensures in the Virgin Islands for people to practice mental health is some of the ways that, we've been brainstorming ideas on how that can increase the people that we reach.
And the development of the autism population.
With what?
Yeah.
Is there anyone else who wants to weigh in on this question about bringing quality mental care to the community? Senator, anything to add to that?
I think it's important that we really put out there that in fact we're seeing where I believe that the issue of behavioral health continue to get the attention of government services.
Senator,
The Department of Health is very instrumental.
Senator, your mic is not coming through.
Media, can you work on the sound on the mic? So I was saying that it's critical that we're able to recognize that I believe that with the state of emergency that has been declared by the governor and also with Commissioner Encarnacion building her team over at the Department of Health, that in fact behavioral health is getting some of the attention that is required and needs. I know that there's a number of initiative that has been started over at the JFL North. I know that 5 rooms have been designated for the purpose of providing the initial care that will be required for us to be able to at least do the assessment and evaluation of our mental health patients as they're brought in, picked up by the Virgin Islands Police Department or EMS and brought into the emergency room. Outside of that, then of course we'll need to ensure that there's necessary the referrals that's made to continue the services, that will be critical. But the JFL North will allow for some flexibility of being able to house at least for 5 days or a little bit beyond. And then we'll have to work towards making sure that there's some other institution that will be available to support that endeavor.
And I think that's a good segue to our next question or our next topic. Because when we talk about access, we also have to talk about the stigma of mental health. So how do we change the narrative?
I have my hand raised. I would like to touch on that subject, please.
Senator Heiliger, please, we'd love to hear from you.
Thank you. Afternoon, this is Senator Frances Heiliger. In listening thus far, I wanted to weigh in a little bit more on even the situation of individuals here in our community that are dealing or in the beginning stages of issues that are affecting their mental health. One of the things that we're seeing here has to do with people dealing with the pandemic, people dealing with the loss of their jobs, they're dealing with a lot of issues. One of the things we don't speak about here in the territory is the rise of suicide that's happening right here because of the unfortunate situation of people's mental wellness. And one of the things, even as myself, I have been an advocate for individuals really utilizing doctors and really us focusing on creating a marketing campaign around taking away the stigma of going to therapists and really focusing on getting mental wellness to the forefront in making sure the same way if something is wrong with your heart and something is wrong with your eyes, you go see a doctor. But for some reason, we shy away from really focusing on getting that mental assistance when it comes to our mind. And I think that has a lot to do with the stigma that's attached to it specifically, especially in a community that is predominantly African-American, African-Caribbean. Now, also the other thing I have noted is that even with here our government insurance, they're fully aware that we don't take advantage of these services. I think this is one of the only places where they specifically have no cap on going to see a therapist. And there's a reason why, because it's not costing them a lot. And if it's not costing you something, clearly we're not utilizing the service. And I think as a government, as a community, we have to tap in to really get this the residents to understand that these services are out there for them, and they should not feel any particular type of way in reaching out for help if they need it. We don't want them to get to the level of where it's too late that we can't get to them. So I just wanted to share that.
Thank you, Senator Francis Heiliger. But how do we, for our panelists, how do we change the narrative of behavioral health from persons in crisis to include behavioral health as preventative care? And for that, I'd like to hear from Mr. Malik Stradiron of 10,000 Helpers. How do we start changing that narrative? Mr. Stradiron?
Can you hear me now?
Yes.
Can you guys hear me? Okay. How can we change the narrative of behavioral health from persons in crisis to include behavioral health as preventative care? First, we gotta let y'all could hear me, you said, right?
Yes.
I could hear somebody else in the background. Like an echo. It's like an echo.
Could everyone please mute their phone, mute their devices? Mr. Stradiron, proceed.
But still had a person in the box. I'll try to go over it. How do we change the narrative of behavioral services on persons in crisis? I personally feel that we need to get the information about what is crisis with somebody. When someone is in crisis with a behavioral health, we need to explain to the community what that is actually. Some people think that the stigma about somebody being mentally ill and stuff is that they're crazy and that there's an average person that you see out on the street. We need to get that stigma out of people's mind about what exactly is a behavioral crisis or somebody that has a mental illness out there. And I think doing the outreach and getting some PSAs out there and actually going more out in the communities, we could try to get that information out there. That's my input on it.
Ms. Poxon from NAMI, do you have anything to add to this? How do we change the narrative?
Yes, Mr. Stradiron mentioned it. The terminology, we need to be more aware of the terminology that we use. A lot of the terminology we use is demeaning. It does not encourage anyone to self-identify that they are managing or trying to manage with a mental illness. So we need to work on the terminology. We as community stakeholders, as legislators, as policymakers, we need to really pay attention to the terminology that we're using when we're referring to persons that are living with a mental illness. And then, yes, we need to work on a very serious, education and outreach campaign. Mrs. Stradiron is right. Many people they associate mental illness with someone that they see in the middle of a crisis in the street, waving their hands about and doing things that people look at as odd. We have individuals that when they see them, instead of trying to take care of them, they're taken advantage of by taking pictures and laughing. There's a really horrible, as a community, we are supposed to be making sure that we care for individuals in need, not make fun or demean them in any way. So a lot of it, we have to look within ourselves, the terminology we're using, how we, if it was, look at the situation, if it was you, or if it was your family member, how would you want to be treated? Don't treat others, in any way that you don't want to be treated yourself. So making sure that we're being careful about the terminology that we're using, making sure that we are really putting out the right information as to when someone is in crisis and what they need, what it means to have a mental illness. It is not always the extreme. Some people are dealing with different, mental health conditions that are required. And they should feel comfortable declaring it, like you said, like someone says they have diabetes, like someone says that they have, high blood pressure. But because of the stigma, because of the shame, because of the discrimination they're going to face, whether it be the person living with a mental illness or even their family members. Some of their family members, they don't want to acknowledge that that's their loved one, or that they're supporting them, because they're afraid of the stigma that's going to, come upon them as though, okay, what did you do? What did you say? How, did you contribute this in some way, shape, or form? So there's a lot that we need to look at how we're talking about mental health as community stakeholders, policymakers, legislators, and then, encourage deeper conversations such as this about mental health, what it really is, and the different conditions. And so people can get a better understanding. It's not the person necessarily on the street. It could be your brother, your sister, your mother, your best friend that you went to high school or grade school all through the years, and then you found out that they were living with a mental illness, and that's why they were doing things that you may have thought that were different.
I just like to interject as well that we have to be mindful, and a lot of times I always allude to the fact that we're all of us are just an episode away from falling off. There's so much situation, workplace stress, there's so much situation in life. My colleague alluded to the fact that even with the pandemic, there's a level of stress, and if it's not properly managed, if it's not properly handled, it could manifest into different things. And it's critical that we are able to find that happy medium, be able to have the confidence to be referred, and as a family member, as a coworker, as a supervisor, we have to be mindful and observe behavioral pattern that could be the indicators that need to just say to someone that maybe you need to see a therapist or make a referral or have a conversation with them, because a lot of times you are right in this position and you don't even feel how you're being impacted. So it's critical that we remove that stigma and work towards that. I believe that the industry standard is to really even stay away from even the word mental illness, mental health, and really talk about the behavioral health aspect of it, so that we can move away from that stigma. But it's critical, as we move forward, and the bill and the work that's being done really speaks to us moving away from mental health and trying to get rid of the stigma, but to be able to provide more and more services so that individuals could readily have access to those services and remove the stigma from our community. But I agree that we only see
Senator
those individuals.
Francis, we can't hear you.
We agree that we only see those individuals I agree that we only see those individuals at time that is fully manifested, and they're acting out publicly to make a determination that perhaps someone is suffering from a behavioral health issue. And it's critical that we, again, be able to observe and be able to be guided. And I guess training has had a lot to do with that. When we have continued awareness advocacies, and I know that NAMI and Island Therapies and some of those have really done a good job in being able to educate the public and the signs and symptoms to look for. But it's critical that we move away from that term, mental illness, mental health, and really the industry new standard is really talk about behavioral health and some of the experiences that we're seeing there to help us to drive away that stigma that's associated that you need to have a total fallout in order to get the necessary care that's required.
So all of our panelists this evening operate in the behavioral health space. And one of the things that the bill on the floor, the bill currently in committee, attempts to do is to create a comprehensive framework to provide behavioral health care and services in the community. But from where all of you sit, what are current gaps in care and services? And I'm going to do this as a round robin question and just give every one of our panelists a chance to weigh in. What are current gaps in care and services? And we'll start with Ms. Schillingford from Catholic Charities.
Thank you, and I'm happy that I'm the first to respond to this question as to the gaps in the present gaps in the services. And I would first begin by saying that the biggest gap is the lack of mental health facilities and the lack of mental health professionals in the territory. The persons who are mentally ill do not need to be incarcerated, and that is what happens. We should not be placing these people in prison. And at the end of the day, when they leave after the incarceration, we put them back out on the streets. And I think awareness is also one of the biggest gaps. And as we sit here, we all, as usual, we are all talking the talk. We are all saying the same things that we've been saying for years. And at the end of the day, when we leave this forum, everybody goes back to their own little corner and we forget. And I think one of the things that we really need to do is come together as a community and start first of all with the education, educating the public. Where do we start? And I think maybe the place that we should start, where we really need to start on the education on mental health, is in the schools. Because mental health can sometimes start, and very often start at a very, very early age. And these children of school age should be able to recognize, the teachers should be able to recognize a child in the classroom may be just acting out, and we say, okay, that's a bad child. The child may just be leading into severe mental illness. We have to start educating the people and getting to them where they are. I think we really need to get the mental health education and awareness of mental health, start at an early age, take it into the schools, and I think that can help. That is one of the biggest gaps. People don't understand mental illness.
Thank you, Ms. Shillingford. And let's hear from our panelists from the village. What are current gaps?
We're on the same track where the lack of education and lack of understanding in the community is a real gap in the care and services, and also the lack of understanding of substance use disorders and how that relates to behavioral health issues. You know, people still have a lack of understanding when it comes to the stigma of substance use and it being an addiction, it being a disease versus a choice. And changing your mind and your belief system around these things is a key part, it plays a key role in how we address these situations moving forward. Because if the family member doesn't believe that your addiction is a disease, if the family member doesn't believe that you actually have a behavioral health issue and that you're just being a bad child or a bad person, it kind of stops the services there. At that point, the community has failed you because you don't have that understanding and you don't have that backing to get you the services that you so desperately need.
Thank you. Now, Attorney Lamont, disability rights. What are current gaps in care and services?
Again, one of the things that we tried to pursue when we did this lawsuit was to bring all the parties together, and there was buy-in from representatives from Department of Health, psychiatrists, human services, NAMI members. There's the creation of what was proposed by the court was a strategic plan to improve the mental health service system. And it was to be adopted in 2014. And there has been sadly no effort to pull it together. It's all here. All this recommends is a case management system so that if an individual comes in from, say, the village or at the hospital, that there is a system in place so that we know how to engage or support this individual, okay? It's sanctioned by the court, sanctioned by the community. Again, it was signed under another administration, but you know, it's psychologists, 10,000 helpers, NAMI, Commissioner of Health, Human Services, a psychiatrist, Dr. Sang, who's still here, The former director of mental health, Doris Farrington, this was like a 4-year project in which, in paper, and it's still, the contents of this is still very relevant now. Perhaps the numbers have changed, but it's still very relevant. And I'd like to add this because there was mention made of supplemental security insurance. Our office is also preparing a report that will be out the end of this month, which talks about, because we are a territory, how we are frankly shortchanged in a number of ways with regard to SSI, which we don't have, but we're advocating for. Thank goodness that our delegate is pushing for that, and the report addresses that. Also Medicaid. We do not have the ability to have a match like, say, Mississippi, okay? Mississippi has more per capita income than the territory, but they, because they are a state, has a better access to Medicaid support. We get a smaller percentage, and that right now it's roughly 83%. It's now, it may change come September 30th. All right, so what happens with the territory, because we're a territory, we're always trying to, catch up. When the time came when the Congress provided 100% funding for our Medicaid program, territory used it to pay outstanding WAPA bills, not pay for, outstanding health services. So some of the frustration is politics. We can't vote for president. We are very limited with regard to what we can and cannot do. The report, I think, will spell it out very clearly, and then we will know how to hopefully advocate, given this administration. I may be a little too optimistic, but if we're looking at this from a social equity lens, then dealing with our Medicaid limitations, our SSI lack of access to, our lack of voting, it's a broader piece. And I don't want to sound like, okay, this will solve it all. No, we are a small community, and I refuse to believe that because we're small, we're not able to make a good choice for our citizens. We can do it.
Thank you. Mr. Stradiron.
Yeah. Okay, you can hear me?
Yes, we can.
Okay, what I think is the gap that is missing too is a list of directory of services where the community and different partners and agencies can actually look, like how you have the phone book and you go to the phone book and then you have this set of directory. Many of the services that are offered, the communities on Facebook, social media, they go to the hospital, they go all over, they're calling, they're asking, where do I go if I have such and such a problem? And then nobody knows where to direct them actually. Like if you want counseling or if you need residential, you need some type of treatment, a lot of places do not have that information. And I know when we meet before, there was a talk about directory. We had FEMA calling all the nonprofits and different agencies to put together a list of a directory, but I haven't seen or heard or even got any information that the directory was released out. So I feel if we do have this directory where we know the village, you contact them for this and that services, or you go underneath, you have 10,000 helpers, you have Catholic Charities, everything under a list of like how you have the phone book directory sort of. If we could have some sort of a directory where the community knows where to go, that also helps them more into understanding what services is out there actually.
Thank you. Thank you. I think we've heard, so let's go to Island Therapy. Current gaps in care and services.
Yes, I just wanted to highlight that I'm totally in agreement with what everyone shared, because the goal is really, it seems to where we're focusing on 3 areas: education and awareness, as well as a team approach to comprehensive care, and also accessibility to services. So what we kind of looked at, and some of these were already listed previously, but just highlighting, we really need an inpatient psychiatric ward, because I think that's going to assist us with decreasing situations where individuals are, for example, apprehended and taken to the prisons when they really need to be in an inpatient psychiatric facility. We also need sensitivity trainings for our officers, just in terms of being able to work through more effectively in working with individuals who are working through challenges in terms of mental wellness. We also need residential care facilities, especially looking at things like facilities for those who are working through developmental concerns, and so in need of independent living facilities, as well as long-term care facilities. And we also need legislation that can be passed. For example, legislation was passed that really assisted us in being able to provide more comprehensive autism applied behavior analysis services, ABA, for individuals with autism. But the thing is, the legislation in the Virgin Islands was strictly passed for only one area, autism. And so because of that, other individuals who might be able to benefit from ABA, they may not necessarily be able to afford it because insurance only covers it if individuals meet the diagnosis of autism. So being able to look for legislation to increase where others can also access it, I think would be really important. But just overall, promoting opportunities for accessibility to services. Another area is individuals who don't have insurance, who want the services, but maybe they don't have a private insurance or public insurance or federal insurance like Medicaid or Medicare, but being able to have opportunities where they can have funding. I know here at Island Therapy, we do like a sliding scale, but sometimes that can be a challenge for some individuals as well. So just kind of focusing on those areas and looking at how we can work on continuing to decrease those gaps. Thank you.
Thank you. And the last panelist in this round is Ms. Parkson from NAMI. What are current gaps in care and services that you hear from the community that you're involved with?
Yes, I have to echo all of the comments that were previously made. But also to what I want to say about the services, I think we need to make sure that we're meeting people where they are in their community. Where we do need all of the facilities, we do need to make sure that we have, adequate coordination of care, most certainly early identification, intervention, housing, but we need to make sure that we're providing care where individuals need it. Asking them to go from Frederiksted to Christiansted, well, we know that's not very far, but for some, that's a challenge. I was encouraged to hear during the hearing that Senator Francis on the 26th, on February 26th, I was encouraged to hear that the mobile wellness vans were en route to the territory, and so they should be deployed. I'm hoping shortly within the community, St. Croix, St. Thomas, and St. John. So I was encouraged to hear that. Because I know that's a challenge for individuals. Those that do want to get care, transportation is an issue for them. And sometimes I don't know what the process will be for the use of the vans. That's something that I know that we will be looking forward to, working with the Department of Health on to see what kind of services will be provided and how they're going to be deployed in the community. But certainly one of the hopes that us from NAMI St. Croix we want to see is that, one, this is a van that's going to be available traveling throughout the islands, providing care, on a regular basis, and also making sure that there's going to be access 24/7. Training is needed for our emergency professionals, our emergency response professionals, most certainly so that they know how to help diffuse the situation. But if we have access to 24/7 crisis intervention team unit that will be able to respond to someone in crisis. It would be nice if it happened in between 8 and 5 and then they're picked up and transported to a facility that's open, but that doesn't happen. I've been a part of those, 3 a.m. 911 calls, and it's really difficult if especially looking at your loved one getting, handcuffed and put into a squad car and then transported to the hospital if they're accepting patients at the time, or if they can even be transported. It just making sure, if we can make sure that we're providing care where individuals need it, making sure that it's available 24/7. In addition to all of the other, areas of concern that others voiced, I think would most certainly be key.
May I add something very quickly with regard to crisis interveners?
Of course.
Okay, I can barely hear. It was brought to my attention pretty recently. There was a homeless person who was picked up by 9 police officers and taken to another location. And needless to say, that was pretty traumatic for the individual. And once that individual was taken to a facility, the officers did selfies and gave each other high fives and applauded themselves. And it took this individual a few days to just get over the trauma of being snatched from where he was and taken to another place. So certainly there needs to be training with regard to that. Because if you're going to be taken away pretty abruptly by 9 law enforcement agencies, that alone is traumatic for anyone. And then the aftermath, pat yourself on the back, take pictures, what's that about?
So certainly, I believe that gaps in care and services are critical, and I agree with everything that everyone have stated thus far. One of the things that's critical for us is that some of the items that have been mentioned have already been addressed by the legislature, and we continue to work with the administration to make sure that we're moving the needle on some of the other issues. Early intervention is extremely critical for us to be able to get in there, whether it's in the schools or elsewhere, and be able to provide assistance to those in need. Substance abuse is critical. A directory is something that I had a discussion with my staff on that I think is critical, that individuals could pick up a directory that give them some definitive of where to find services. And it's something that we intend to undertake within the Committee of Health, Hospital, and Human Services, and be able to provide that to the community as well. Residential care facilities is something that we're working on. As you know, we had provided the $3 million for Anna's Hope, and if it's not Anna's Hope, we could do it wherever we want to go. We need to really arrive at a consensus whether or not we believe that we need a public facility, or perhaps we need to create a public-private partnership with a private entity that could provide the necessary care and services that's required. The legislation regarding autism is something that we had moved back in the 32nd legislature, and I'm interested to hear from Dr. Parija how we can strengthen that and move an amendment to address the shortcomings or the gap that continue to exist in that particular piece of legislation. The crisis intervention team and the sensitivity training is something that continue to be at the forefront. I know in conversation recently with the Virgin Islands Police Department, as a matter of fact, on the 26th when they spoke, we had Deputy Commissioner Walwyn and Commissioner Vellenor that pledged that in fact that we'll see a lot more of the CIT and the crisis intervention teams and training being conducted so that our officers could really appreciate and get the necessary sensitivity training that's required. These individuals are in crisis. They're not functioning in their normal. So of course, they're not operating in the normal. So we don't want to make fun and belittle and incarcerate them at a time like this. So that is something that we certainly have to work on. I just want to provide a little sneak preview. I know that we discussed the vans, and it hasn't been made public yet, but the mobile substation is on island. Driving by Charles Howard recently, I saw it parked at the Charles Howard Hospital, and I think it's important that I give kudos to my former colleague, Senator Nellie O'Reilly, who really had the vision and passion when we were moving the legislation to make sure that the mobile substation was available and made a part of that, and we certainly provided the funding for that. And we're happy to hear that they're on island, and I know that Department of Health will be doing a release on that in the very near future. But I'm sorry to jump the gun, but I know I'm pretty excited about having those vans on island, because we've been talking about that, and those vans will be able to go out into the community, be deployed into our community, and be able to take services to those in need rather than waiting for them to come forward for those services. So I like the responses that was given regarding the gaps in care and services, and it's something that we have to work collectively to address. Ms. Richards?
So one thing that we see with the lack of a inpatient facility here on St. Croix is that unfortunately too many of our mentally ill end up in jail. So is there any continuum of care for persons who may become incarcerated? And I'm going to direct that question, I'm not sure who to direct it to, but I'll start with Island Therapy. Is there a continuum of care for persons who may become incarcerated? That question is for Island Therapy.
So currently, we are working with the Bureau of Corrections and doing care for people that do have mental, behavioral issues or whatnot when they come into the prisons. So we have been doing some psychiatric care for them, and also psychological evaluations, and some different therapeutic interventions and stuff like that. So that is one area that we're able to. We just started working with them within the last couple of months, so I know they are definitely seeking those services out. I think that I will say that the struggle comes when somebody who has mental illness or has a behavioral difficulty come up because of the mental illness, and they end up taking them. I think somebody commented on this before, but they end up taking them to jail instead of the hospital. Where they needed to go to the hospital and be stabilized and stuff, and they end up going to prison because maybe they punched a hole in the wall or they did something like that. And that has become a really big challenge, is sorting that out and making sure that they're getting the help that they need. So that's what we were which goes back to having, I know St. Thomas has an inpatient unit that they can stabilize patients, but unfortunately in St. Croix we don't. So really working on that would be huge to help that transition, and hopefully people that don't need to be going to jail and not end up in jail.
Thank you. And is there anyone else who wants to weigh in on the continuum of care when persons become incarcerated? I know that's a huge issue in our community. So any of our panelists want to weigh in on that?
Yes, here at the village, thankfully for us, we have individuals in the criminal justice system, to include judges, wardens, and attorneys who see the need on the substance use disorder part of it, and even the individuals in the AG's office who will request that a screening be done on certain individuals to see if they meet the criteria for substance use treatment, and have that be part of their stay or their pre-trial release conditions, as opposed to just sitting in prison or just waiting for a sentencing. They can receive the treatment that they need, and if there is an underlying mental health issue there, we navigate them receiving the services they need through the FHC or
Department of Health.
Or Department of Health to get that done. So we thankfully, the criminal justice system is aware of the village and the work we do, and has begun referring individuals over here instead of having them sitting in prison unnecessarily.
Thank you. So, Senator Francis, you wanted to weigh in on that?
I just wanted to add that, again, when we have the situation with individual being incarcerated, we visited the prison recently, and again, that is not a good fix. When we have individuals that may be suffering from some behavioral health issue, having them incarcerated, even in an isolated area, present additional challenges. And I certainly hope that we could see the day that we could have an institution or be able to make necessary referrals outside of individual actually being incarcerated. A lot of time, unfortunately, because of the situation that we find ourselves in, is that in order for individuals to begin to start to receive services, we wait for them to commit a minor infraction and then get them into the criminal justice system, and that will help to perhaps force the services that they're required, but it's not a good fix, and it's something, if not immediately addressed, it just lends itself to a long-term behavioral health issue. So I believe that we really need to work towards improving that type of situation that we find ourselves in. So I think as a community, we have to work to reverse the way by which we're actually incarcerating individual because of behavioral health issue, so that we could provide them with the necessary services versus incarceration.
And I see that Mr. Stradiron wants to weigh in on this topic. Mr. Stradiron?
Yes, I know for us at 10,000 Helpers, BOC and the judicial branch also calls us and go through cases with individuals with mental health, behavioral issues, and we do a treatment plan where they ask us if we're able to house the persons while they do a treatment plan for them to get counseling, whatever therapy that is needed and stuff. So as long as we have space available, we also work alongside the judicial system, and we take the clients if they're in jail. I got an opportunity to go in, speak to them, speak to the person that is incarcerated, and give them an idea of what our services are and what help is needed, and if they would like to have that opportunity to come out under the treatment plan, that we will hold them, what is the guidelines for them, and XYZ, and it has been working out as long as we have space. I know they contact us and tell us exactly what's going on, who they have, and if we're able to assist them in getting them the residency as part of their treatment plan.
Thank you. So we're going to move on to our next question. We see so many families that are struggling and really don't know where to start. So what types of training do any of your organizations offer, or resources for families and individuals to help them cope with behavioral health issues? What type of resources? And that's an open question. Anyone can jump in.
Well, I'll go first.
Go ahead.
I'll go first. What we do is if you call our number, if you call the emergency number for us, we basically set up a one-on-one with the individual, and we go to the home and we listen to the issues from the family, and then we take the individual who they're talking about or we're discussing and put them on a side and speak to them also, and let the two sides know that we're neutral, and we try to understand from both sides what's going on, and then we kind of give them a caseworker and assist them where now we're trying to give them the services or whatever help that we can, or we refer them to other agencies as usual, other organizations, but we don't leave them standing by themselves. We basically let them to know that we're there with them step by step so that we can get them to where they need to be, especially since a lot of times the services that they're requesting, majority of the time is after hours. You know, the person acts up after 5 o'clock and then nobody knows what to do. So at that point, we're trying to tell them to know that if you call us, we're still there to assist, because majority of these programs and nonprofits that are here usually work 24 hours anyway. So it's not hard to get in contact with anybody, a director, a worker, or a facility to say, well, we need some assistance and help for this family. So that's what we offer. If they call and they need some type of one-on-one counseling, help, where to go, references, what to do, we try to assist them by coming to their homes and letting them know what exactly we can do for them.
Thank you.
Yes, and this is Sherilyn Paxson from NAMI St. Croix. I am very proud, excited about the NAMI Family to Family program. It is a free 8-session education program that's for family, friends, significant others, or of adults that's living with a mental illness. And it's a program that's taught by trained family members who have a loved one with a mental health condition. So they're sharing their experiences. You're talking to someone that's lived or experiencing what you're currently experiencing. And so through that program, we're able to provide information about the mental health conditions, some communication skills, problem solving, treatment, recovery. And the core reason for the program is really to help increase understanding, increase understanding about what your loved one is experiencing, and improve your own advocacy skills, whoever you are, whether you are a parent, family friend, significant other, and also focus on maintaining your own well-being. Caregivers are very, very stressed out supporting their loved ones. Mm-hmm. And I actually became affiliated with the NAMI organization through the Family to Family program. I am a caregiver providing, trying to support my loved one, and I didn't know where to go. So I didn't know what to do. I came across this program. I participated in the program. I saw the importance. I saw the significance it made for my life. It made for my family members' life. So we're very proud. This is a national program that's evidence-based. This is a program that we're we've taught here, and actually it's open for individuals that are interested in participating in a new class. And we're also working on developing peer-to-peer programs. This is something we have not done before, so we are reaching out to other organizations to identify peers that want to go through training for a support program so that they can go ahead and support other peers, other individuals that are living with mental illness. And I neglected to mention when Mr. Stradiron mentioned about the directory earlier, that there was that listing that had put together by that collaboration of all nonprofit organizations. It did not go to waste. Actually, NAMI St. Croix picked it up, and we have put something together. We have not published it yet, so we will certainly reach out to Senator Francis's office, and as we make sure that we get all the information out there. It is a collaboration of all of the different organizations, and the work was actually started from that collaboration of nonprofit organizations that work to pull all of that information together. And so we made sure that the information is still current, relevant, and it's a living document that will be published on our website, NAMISDX.org. Anyone can call us, talk to us, and we will be sharing that information. So I will also work with Senator Francis's office on that to make sure that it is something that is readily available.
Okay, so as part of our prevention programs here at the Village, where we recognize the need that families have to become more educated and just deal with the issues of mental health and substance abuse, we have several programs available to families. One is the Strengthening the Family program, where it helps to build that bond and knowledge in the field of substance abuse and mental health and other daily things that would affect someone's mental health. So we have the Strengthening the Family program. We have our Progressive Lifestyle program, which are pairs of teenagers and our young adults get together and they have discussions, open discussions with the topics of substance abuse, mental health. We put out public PSAs through our websites. We have different campaigns that we run from time to time, trying to educate the public and families to help initiate the talk about mental health and substance abuse a bit more. We also have our Prime for Life program, which is also under the prevention side of the Village. And with the Prime for Life program, it fosters now it's virtual, our young people to become involved in some classes that teach a realm of issues from, like I said, substance abuse, mental health, peer pressure, all of these things. But it's a course, a 7-week course, I believe, and it's now virtual. And we continue to give all these services from Strengthening the Family, Progressive Lifestyle, and Prime for Life virtually now that we have the COVID pandemic going on. From time to time, we're going to be putting out stuff where we will be within the community. We started last week, Friday, at Canigata Ballpark, where the ladies were out there giving out information. We were providing some testing, HIV, hepatitis C testing, stuff like that. So we are getting out in the community a little bit more, that we have a little bit more leeway with open door, somewhat of an open door phase. And we're trying to become more vocal through our Facebook website.
And also on the treatment side of it, we do our best to keep the families engaged, because so many times you will see families just want to get rid of the problem, so to speak, and drop them off and disappear. So one of the things we try to do in the treatment side is to keep them engaged and help them understand the course of treatment, what the individual is working on, and also provide them the resources that they would need to keep themselves engage and understanding it from their side of the fence. When the individual is finished with treatment, there is that foundation there that to strengthen the family and to go on and go forward with in assisting the individual to live a productive life outside of treatment services.
Anyone else? Okay, so we've heard throughout this entire conversation tonight a mention of education and early education, but we haven't really touched on the topic of services for our youth. And we know that there's a strong connection between mental health, behavioral health prevention, and early intervention programs and success in school. And research shows that adolescents with a mental health condition will see its manifestation by the age of 14. So what steps can we take to ensure implementation of prevention and early intervention initiatives in school and health settings? And I'd like to start with Island Therapy to address that question, to answer that question.
Can I? Yeah, hi. I'm really glad that we got to this, because I think that there is a lot that needs to happen with our young people. I will say that for a while, we did have a really strong, comprehensive system of care where we had services in the schools, early intervention, residential care, short and long term, and then reintegration into the family system. I think having those kinds of services where you want to provide services for young people as close to the family and the home as possible. And then when they need to come out, you want to keep the time as short as possible and have them go back in, providing comprehensive services. And understanding that this is where the earlier you start, the better chance you have of reducing stigma and of really seeing and teaching family members and the entire community as we grow about the fact that mental illness is just another physical illness on some levels. One big gap that we really need to address is as the child ages out of the child system, the educational system, when they turn 18, until they get into the adult system at the age of 24, 25, that's where you're really growing people that, if you don't give them services, are going to have chronic mental illness for the rest of their life. And I think that is a key point. That is that gap in services between aging into adulthood and actually being able to handle themselves. So that is one critical piece that I think we need to address. But I must say that I think, and I would ask Dr. Wagner to weigh in on this, because we do provide a wide range of services here, and I think there's even more that can be done.
Yeah, I mean, I would say that one of the biggest things in identifying and catching mental illness or developmental disabilities early on is early identification. One of the ways that we've been successful with that is educating the teachers. I go out and do free talks for the schools, for the teachers, and just doing education on what does a developmental disability look like? What does signs of depression look like in a 10-year-old boy? What does that look like, and what do you do once you see that, and how do you move forward with that? And I would say that we have more now than ever referrals constantly from teachers. Tons of teachers coming, referring kids. We're seeing up to 20, I'm personally seeing up to 20 to 25 children a week, new children a week. And most of those referrals are coming from the education system, from teachers. So the early identification is absolutely huge in getting them the services so that we're not ending up, long-term dealing with everything.
Thank you. Anyone else want to weigh in on that question about just how we're serving our youth population, our younger population? Okay. So I'm just going to throw one more question out there before we go into our question and answers from the public. And in this past year with COVID, the entire community has been under tremendous stress. From your own perspectives, what pressures have COVID placed on the community, and what measures have any of your organizations taken to help address them? So if we could start with, let's start with Catholic Charities, Ms. Shillingford. The pressures of COVID.
The pressures of COVID would involve lots of job loss, people not being able to pay their rent, people not being able to pay their utilities. And can you imagine what it's like to wake up one morning, and every morning you have to wake up and you're not sure if your landlord is going to be at your door with an eviction letter, or you're not sure your children have to do their classes online. You're not sure if WAPA is not going to disconnect you. And that causes a lot of stress for parents. So what we have been doing is providing individuals, we've been providing individuals with rental assistance, counseling, utility assistance, and I guess basically that's what we do. Counseling, providing utility assistance, rental assistance as much as possible, because there are lots of people out there who really, really are suffering, and we try as much as possible. If we cannot assist, we make referrals to other agencies that we think will be able to assist. We have developed a very good relationship with the Department of Health. So if we realize that there's somebody who needs more than what we can offer, we would refer them to the Department of Health, Mental Health.
Thank you. And go ahead.
Sorry.
Can you hear us? Okay.
Yes.
So what we wanted to share is definitely we agree with Ms. Shillingford regarding the pressures of what COVID has placed in our community. We are seeing things like, in addition to financial constraints and impact on individuals at the workplace and school and so forth, there's also an increase of low moods, such as depression. There's an increase of anxiety, a whole lot. Whenever we have major changes or major shifts, or after any kind of major traumatic event, which we are going through now due to the pandemic, we tend to see where individuals are responding in different ways, which says, I'm having a hard time with this. In children, we tend to see it more with behaviors. So they tend to not use their words as much, but their behaviors are saying, I'm having a hard time. Adults, we tend to do it similarly, but we tend to use more of our words. And so those are some of what we're seeing there. One of the things
one of the things I'd like to add to that also is a really big stressor that we're seeing for families in general was the transition to virtual learning.
Yes.
Because parents were having to teach, be the teacher, the parent, the full-time employee, you know, and all of that. And that has been, for a lot of our families, very, very stressful. And so one of the responses that, you know, we've have formed or gotten a grant with Department of Health and SAMHSA and FEMA, and to provide crisis counseling services to everyone after the pandemic that are free services, trainings to agencies, to employers, to anybody that wants the trainings, going to talk about coping strategies, how to build resiliency, individual, you know, mini counseling sessions. If it's more of a severe mental disorder, then we will pass it on to a licensed counselor. And that grant just got extended until November 7th?
November 6th.
November 6th. So we have that until November 6th, and that is the Community Resiliency Project. So you'll probably see a lot of advertisement and start to hear about it on the radio a lot.
Thank you. Anyone else wanting to weigh in on this?
Yes, we Malik for 10,000 Helpers. We took a different approach when it came to the COVID-19, the pandemic, and what we did was we were discussing with Administrator Sanis about how we could actually have a place for people that are homeless, mentally ill, that population. If they were struck with the COVID, where will they go to quarantine? So what we did was we teamed up with Divine Funeral Home, and we got some money from the CARES Act from the governor's office, and we started to build a shelter out of containers, which will house 8 individuals. It's gonna be a shelter for homeless, mentally ill individuals who need to quarantine if they have any symptoms or signs or anything of COVID-19, and we're proud to say that soon it may be open, couple months, 2-3 months. But that's the approach we took since we're advocating so heavily on transitioning the homeless and mentally ill. So we got assistance and collaborated with Divine Funeral Home, and we're doing it as a collaborative project where soon we're gonna have a shelter just for people that are mentally ill and homeless to quarantine if they do have or struck with the COVID-19.
Yes, hi, for NAMI St. Croix, we recognize that loneliness, social isolation is a major issue. Unfortunately, as has been stated, individuals having to make that transition over to the virtual world is not easy. If you don't have access to the technology, if you don't have a smartphone, we want to assume everyone does, but not everyone has a smartphone, not everyone has a computer, not everyone has a tablet, not everyone has internet. You know, a reliable internet where they can stay, where they can participate in forums such as these. It's what we have because of the pandemic. So what we know that it's something that needs to certainly be addressed, but what we've been trying to do is just stay connected with everyone. We've been maintaining regular meetings where individuals can just call and say what's going on. We provide updates from time to time, what we're doing, you know, certainly amongst our group. But staying connected is really what we feel has been helping, certainly with our group. It's hard to stay connected over the phone or on Zoom or on Teams. It really is. But we encourage everyone to just think of inventive ways. WhatsApp. WhatsApp is something that I think many individuals certainly use here in the community. If it's not Zoom, if it's not Microsoft Teams, if it's not Skype, if it's not WhatsApp, even with the smartphones, we have FaceTime. We've been encouraging individuals to when you call someone, turn on the camera so you can see them. You know, sometimes we're talking on the phone and everyone's just, you know, nodding and saying what you're supposed to say. I'm all right, because you don't really want to admit that you really feel isolated, you really feel alone, and you really want to connect with someone and, you know, in person, but it's difficult. So we say, you got to turn on your camera. We got to see you. You know, you got to put a smile on your face. I don't know, put some makeup on, do something. Just so when you are talking to someone, you feel like you're somewhere, you've gone out, you know, dress up. even encouraging individuals to stay connected with their family members using the resources that they do have. If it's not a smartphone, if it's not a computer, it's not a tablet, I don't know. There are very few people that I know personally that doesn't have WhatsApp. So use WhatsApp. You try to find different ways to tune in with each other, because picking up the phone or connecting online with any one of these virtual tools that we have access to is key. We know that we are working our way towards having more in-person events, and that's really where we were at most of our engagements with our community has been in-person events. And so we have seen a drop off in that because of the change over to the virtual world. But even so, even a text message. I sent out a whole bunch of text messages this morning, and I see a couple of people on the call that I hope connected because they saw the text message. We have to explore all avenues of how to stay connected, because isolation is a real thing.
And that is an excellent segue to the our question and answer portion of the town hall.
Before we go there, I just wanted to say that in my conversation with Department of Health and the clubhouse, they also spoke about going towards the virtual world in terms of their contact, and they continue to stay in touch with their patients via that medium. However, they're hoping to resume in-person contact in the near future as we continue to control the COVID pandemic. But in fact, Department of Health and the clubhouse continue to at least be able to stay in contact virtually, and that is a good thing, and we're hoping that that continues until such time that they're able to meet in person. So, Ms. Richards, you said that we are going to start to entertain some questions.
We're going to the to our Q&As, and we've received some questions by email. And one of those is, what are the considerations or measures to include family members as a support system for persons working their way through a mental health crisis? So how are we supporting the caregivers? How are we supporting the caregivers in our community? Anyone can jump in.
Ms. Pogson?
Well, I know for NAMI Singh Roy, as I mentioned the family-to-family program that we have. But I do think that that's just one thing that NAMI Singh Roy is able to do. But I hope rather that the directory will help, because it'll ease the stress that family members are caregivers are trying to deal with, trying to maneuver through the system and what is available, what isn't available. But support groups, it has been something that's really been helpful, at least to some of us.
Ms. Parkson, do we believe that that's an area that there's a lapse or gap in, and then perhaps as a government entity that we need to focus a little bit more in terms of providing services to support our caregivers?
Actually, the Department of Human Services has a family support program that I believe I know that they meet multiple times. I don't want to say the wrong day. Of course, you'd have to reach out to them, but I know that they do provide a program for family to support family caregivers. Could there be more that's done? Absolutely. A lot of the stress that family caregivers are dealing with is not having access to the information, as we've talked about multiple times this evening, and knowing who to talk to so that we can get our own make sure that we take care of our own selves. So is there more that can be done? Yes, I think coordinating with the Department of Health to make sure that there is a referral, not only bringing in our loved ones to go ahead and receive care, but what program that's housed in the Department of Health. If it is a referral to the DHS program, that's fine, but certainly ramping up the promotion and the sharing of that information so the family caregivers are more aware of it. And certainly I know that there is work that NAMI St. Croix has to, there's more work for us to do to make sure that we're sharing the information about our the family program as well. So something, that's something that we can do, more collaboration to make sure that family caregivers have access to information and more support programs in whatever medium is convenient for them, because they're providing care and they're working. They may not be able to go to a meeting, but if it's accessible virtually during after hours such as these, that might be more beneficial for them.
Okay. And again, we want to open up for questions, and if you could simply raise your hand if you're able to do that. If not, if you have any questions for any one of the panelists, you feel free to do that at this time. Preferably if you could direct your question to someone in particular. If not, you have a general question, we'll try to get the person with the most information to respond to your question.
So while we wait on questions we've taken some questions from Facebook and got some by email.
I have a raised hand. I'm sorry. I have a raised hand. Senator Carla Joseph, you're recognized.
Thank you so much, Senator Novell Francis Jr. I really want to first commend you for having this town hall meeting. Definitely the mental ill in our community is a real crisis and very critical for us to address on a holistic avenue. I wanted to ask Ms. Cheryl Paxton. I listened, I came in late, I do apologize, and good evening to everyone. I should have said that on the front end. I wanted to ask you, Ms. Paxton, and I listened to some of your presentation, and I thought it was very good. Do you look at bridging and coming to St. Thomas and possibly doing something of the sort over here as well, and collaborating with some of our very strong NGOs to include Catholic social services and Methodist outreach? Is some of those things being done, the groundwork starting to happen?
Thank you, Senator Joseph. Absolutely. We actually have a NAMI St. Thomas affiliate.
I can't hear you, Ms. Paxton.
Is that a little better?
Can't hear.
No, not at all. Oh no.
That was me. That was me. Go ahead.
Okay.
That was my bad.
No worries. What I was saying was that yes, absolutely, work is being done. We have a NAMI St. Thomas affiliate, and one of the conversations that we've had with NAMI St. Croix has had with NAMI St. Thomas is that we are a small community. Capacity is an issue. You know, as I said at the beginning, we're a group of volunteers, and just by virtue of why we've come together, we're all caregivers or significant others, taking care of a loved one. So sometimes it's a challenge. And capacity is an issue for us. So there needs to be more collaboration amongst NAMI St. Croix and St. Thomas, in which we have actually made recent efforts to do so. In addition to the programs that we've begun work on here on St. Croix, yes, we have started to reach out to other nonprofits on St. Thomas as well. So that we can make sure that whatever we're implementing here can be implemented over on St. Thomas. So we have an affiliate over on St. Thomas that we are in touch with, and we're beefing up the collaboration so we can make sure that whatever is done here on St. Croix, it can be duplicated, especially now in this virtual world. You know, that was the comment that we made. Why aren't we collaborating more in the virtual world?
Thank you so much. That's very good. Thank you. And I just want to lend my support and in anything that I can do. I do love to volunteer. I have a lot of time on my hand, and sometimes we could schedule times to volunteer, and you can always reach out, Senator Novell Francis, if you need to get additional support in the St. Thomas, St. John district, because we too have a major issue with our homeless, and we see the correlation between being homeless and the mental illness too. So definitely I would be very much supportive of volunteering and lending whatever skills that I have to support this effort. Thank you.
Thank you very much, Senator Carla Joseph. At this time, any other questions? I know that Sheila, are you still on the line? You had a question earlier. Ms. Scullion? If not,
Okay,
Ms.
so
Richards.
we got some questions that were emailed, and one of the comments that we got on by email was how are we engaging and assisting our shut-ins facing mental issues, which has certainly been a bigger problem during COVID. And second, how can we ensure the elderly with mental illness brought on by isolation and other factors are addressed in our mental health assistance programs? So how are we engaging and assisting the shut-ins, but how are we also ensuring that the elderly with mental illness are having access to services as well? And any one of our panelists can jump in with that.
To me, that question kind of rough, because that's more like on human services, you know, especially when it comes to these cases. We don't, as us for nonprofit, people have to call us and tell us their situation. So with the sit-ins and the shut-ins and stuff like that, with the services, that's more like a human services to me role. If they reach out to us now and they refer them to us, then we're able to assist them. But I don't see us being able to answer that question really and truly.
Okay, anyone else?
I would say
I would like.
Is Melissa Darren the one that was on mute?
Okay. Can you hear us?
Yes.
yes.
Okay, thanks. Just kind of wanted to share, I recognize we have some limited resources. So, you know, as a result, I can totally relate to what you're saying, Mr. Stradiran. In addition to what you shared, I do want to point out that because we got the Crisis Counseling Grant, also known as the Community Resiliency Project, we are providing services remotely. So, you know, individuals can access services via telephone. If they need to talk with someone, they can call our office and ask to speak with a crisis counselor, 340-719-7007. And that's through the grant that we got through FEMA, SAMHSA, awarded by Department of Health. In addition to that, we do presentations, some of which are on Facebook Live. Those are usually on Fridays, and we're getting ready to start them on Tuesdays, so that, you know, individuals can access services. Also, we do provide services via Zoom. So individuals who are not able to come in physically for services, they can access services remotely. So I just kind of wanted to share that as well. Oh yes, thank you, Dr. Grant. For the crisis counseling program, also known as the Community Resiliency Project, they can call in anonymously. So they do not have to give their names. They just need to say, I'd like to speak with a crisis counselor. I'm really feeling, you know, whatever the situation may be. And our front desk staff will switch them over. The program is also available in St. Thomas and St. John, and it's through Insight Psychological Services. So in St. Croix, Island Therapy Solutions had it, and in St. Thomas, St. John, Insight Psychological Services. Although it's not germane to where anyone from anywhere can call anywhere. So people from St. Croix, if they want to call Insight in St. Thomas to access the services, they can. Individuals from St. Thomas and St. John, if they want to access the services in St. Croix, they can. So just wanting to point out that that is a service that's available for anyone, and including our shut-ins, because we do want to be sensitive to meet their needs however we can.
I also want to let everyone know that as far as senior citizens are concerned, ARP has certainly started to do some work. In the realm locally, we've been focusing on mental health nationally for quite some time, but ARP has been working with the Department of Health and the Community Resiliency Project just recently. In fact, information was shared around mental health and the care for seniors. So I would look out for more information on that. Anyone that's trying to get access to information or services for a senior citizen, I most certainly contact ARP, the website, call the local office. There's more information coming out on that.
And we have a comment from one of our online viewers about the availabilities of prescription treatment. She hasn't heard much in this conversation tonight about prescription treatment for those suffering from mental illness. So for families who have this question, where do they start? How do they get those services, those prescriptions, those medications for their family members?
I'll answer that first. As far as here at Island Therapy Solutions, we have 3 psychiatrists that we work with, that we collaborate with. And so they, see patients on a weekly basis here at the office. And then we also have 2 psychiatric PAs that we have here at the office for prescription services. We are still pretty booked out at this point, and it's still an area on the territory that certainly needs more and more services in. So we are working on hopefully hiring some more people in that area to bring more of the psychiatric medication management services to the territory.
Thank you.
There is a question online, I think from Phoenix. You have a question? Is there a question?
Hello? I think you see the name of my phone.
Yes.
I apologize. I apologize. I had a question in regards to the substance abuse part of the discussion. I know when I first was introduced to mental health services, not much was no one really spoke about the substance abuse issue and how important it was in the discussion. And I think at the time in my life, I was very young, and someone could tell me anything and I'll believe anything. But after being diagnosed for 10 years, I do feel that it's very, very relevant. And often because of, I understand the person's at the forefront. You kind of have to be at a different stage in your life to really be at the forefront. So I understand why someone at the forefront wouldn't talk about substance abuse often, but I do feel that for someone who was diagnosed at, I'm very young, but, in my 20s, that having that discussion at the moment when I was diagnosed would have been very, very important in changing how my life occurred. So just, speaking from someone who developed symptoms and within a couple months, I was diagnosed. So I don't feel that there was a big delay where my life needed to fall apart. I do feel that the discussion really was not there. And it's not really a criticism, saying that I have, heard everyone's story. It's more so as I look in the media, I think people talk about mental health, they talk about depression, they talk about schizophrenia, they talk about the different mental health diagnoses that's usually very, very popular in terms of speaking and understanding mental health. Those diagnoses seem to be, people are more educated on those, multiple personalities and things like that. But in terms of substance abuse, really understanding the issue of substance abuse and how it relates to mental health, that's something that's often not really discussed, especially with the quick ads. You probably wouldn't even hear the word substance abuse in a very quick ad. So, I was living on St. Thomas and I went through mental health services in terms of substance abuse treatment and substance abuse, understanding how substances play in your life. That really was not ever the focus in my mental health treatment. But once I moved to St. Croix, I did hear about the village and seeing that they are a panelist, I think although I was a member of NAMI and I participated in NAMI meetings, I would say even in their meetings, substance abuse was never really talked about ever. And I don't think that was quite doing persons who are diagnosed justice, as well as allowing persons to understand how
Phoenix.
their mental illness might have manifested. So I was saying in terms of the work that the village is doing, in terms of if you're really trying to do mental health outreach, that I do feel that, working with agencies like the village, which specifically deal with substance abuse, because I think this is a factor that a lot of persons don't factor in when they begin to experience
Phoenix,
symptoms.
let's
Not
give
that they might
the
have
village.
a problem.
Let's give village an opportunity to weigh in and address your concern in regards to substance abuse and its impact and effect on mental illness or behavioral health. Can we get the village, and maybe we could also ask Dr. Wagner to weigh in on that real quickly?
Hi, yes, good evening. Yeah, she is correct in that substance use does sometimes go hand in hand with certain mental health disorders or co-occurring disorders, as they're sometimes called. It's not uncommon to have someone who has a substance use disorder to also be diagnosed with bipolar disorder, depression, other mood disorders, schizophrenia. That's also part of it. Which one causes the other? Research still, hasn't agreed on that, but it's very common to see that sometimes the two does go hand in hand, and some substances do mimic certain mental health disorders. So it's very important when someone does come in for a substance use treatment and they're given that proper time to detox, that they do get a psychiatric screening, even if they never had a history of psychiatric issues. So the psychiatrist can determine, were their symptoms a product of substance use issues, or is this an underlying issue that was always there and they were self-medicating all this time? So the two, yes, do go hand in hand, and that community collaboration to work together with someone in a psychiatric field along with us who provide the substance use treatment is extremely important.
Very well, thank you. Dr. Wagner, you want to weigh in on that real quickly?
I mean, I think that she hit the nail on the head. I mean, exactly everything that she had said, it's just whether or not what came first, and trying to treat it and trying to figure out what's going on, as far as whether or not the substance abuse was developed from, them coping with the mental illness and that was their coping strategy that they were using. So, I mean, yes, they hit all of the points on that.
Very well. Dr. Wagner, while I have you, there's a notion that we don't have enough psychologists and psychiatrists on the island. Is that a fact, or we are not aware of how many service providers we do have? What would be your comment in regards to that notion?
I would definitely say we are short on psychiatric care. Like I was just saying, I think at our office, we're booked out until the end of April on psychiatric appointments, which is unacceptable. We can't have people on waiting lists. I mean, as soon as somebody gets up the courage to come into our office to get the services, we need to have them available immediately. But it's very difficult to hire people and to bring them down. Telehealth has been helping, and so we've been able to get a little bit of help with, but it's a nationwide shortage of psychiatric care, really, and psychiatrists. So as far as the psychology realm, I would say, yes, we probably definitely have a shortage of psychologists also. The good news is the counseling board is now licensing people to start doing counseling services. So that's up and going. So there's more access to the counseling piece of things, which will be, definitely help in getting more of those services out there.
Very well, thank you for that. We're nearing the end. I just wanted to, Ms. Richards, if you could just have our panelists just do a quick 15, 30-second wrap-up, and we could go towards closing comments.
So thank you for everyone who has shared their questions. For those of you who emailed, we will be responding to questions offline as much as we can. And I'd like to give our panelists a chance for a very brief wrap-up. And since we have Island Therapy on the screen, we'll start with you.
Hi. So thank you so much, sorry, to the Senate, Senator Novel Francis and the team for inviting us. This has been a great pleasure. We just want to be able to let the public know that part of our goal is increasing accessibility to comprehensive services. And so as a result, at Island Therapy, we provide individual, group, family consultations, trainings, and really working to enhance and promote our wraparound services and also collaborate with other agencies as well. We enter into relationships with government as well as nonprofits and other agencies. So our goal is really to increase and provide support to our community. We recognize that right now we're going through some trying times and wanting to be able to be a part of that solution. So once again, thank you so much to Senator Novel Francis and the team for inviting us to be a part of this. We really welcome and want to be a part of continued conversations, especially in being able to increase work in the areas of legislation, because we do recognize that there's a need for that can really assist our community in assessing services. So thank you so much.
Thank you, Ms. Pogson, for your brief wrap-up.
Yes, thank you very much. I just want to say thank you again for the invitation, the conversation. We realize that the challenges of mental illness do not only affect the individual family members, but it also affects friends, teachers, neighbors, co-workers, others in the community. Therefore, we want to make sure that we continue this type of discussion, open dialogue about mental illness, the things that we can do, collaborate better, because any system that we put in place in the territory is going to require the resources and support of all of us. So we say we want to encourage this type of dialogue. And Nami St. Croix and Nami St. Thomas. We will be here, ready, willing to assist and provide whatever support is necessary, not only for our caregivers, but for our loved ones that's really trying to manage through a mental illness. Thank you.
Thank you, Mr. Stridiron, 10,000 Helpers.
I would like to thank you, Senator Francis, and your team also for having this town hall meeting. I think it was more needed than everyone out there would really understand. People in the community have been asking about this topic to be addressed and to have some sort of conversation and means of communication. And here at 10,000 Helpers, we just like to let all these other agencies and everybody know that we're here to collaborate with anyone and everyone. We advocate specifically for the mentally ill and homeless and transitioning them. So as much as we can help, you could feel free to call. Where we have a little issues with the building right now, we got vandalized, so we kind of have it shut down, but we're doing outreach until we get the remodeling done and stuff. And just a reminder to all of us, to the community, that we believe in a HIPAA law. So we want to make it known that all of our organizations believe in following the HIPAA law, and we would like the community to know that if you're scared because you feel that somebody's gonna give your information out, or you feel that you know someone and you're not comfortable with it, we believe in a HIPAA law. And to all of our other organizations and people that are helping through the pictures and the selfies and stuff like that when you're with someone or assisting someone, please stop. I mean, we're advocating for that as well too, because that's not good. So I'm asking, you know, the selfies, the pictures, you see someone on the street, that's a part of legislation. I feel too, or the law that needs to go into place, that you don't take selfies of individuals that are mentally ill or because you're helping them and stuff like that. So that's my 2 cents. Thank you guys so much for all the assistance that you do. And once again, HIPAA is my biggest key out here when it comes to our job. Thank you very much.
Thank you, Mr. Stridiron and Ms. Lamont.
I'm sorry, was that me?
Yes.
Thank you, Sherilyn. Okay. Thank you, Senator Francis, for this wonderful opportunity. I just want to add that our Disability Rights Center, the Virgin Islands, all you need to call is one number. It applies to St. Thomas and St. Croix and St. John, 772-1200. Our website is drcvi.org. Our report will be released on the website. Some of you will also get hard copies. You can call us if you'd like a hard copy of the report, and it will deal with SSI, Medicaid, data collection, voting, etc. Just so you'll know, in summary, the Disability Rights Centers does referrals, monitoring facilities. I mean, we are charged with the responsibility if someone is abused or neglected in a facility, we are exclusively mandated by federal law to go in and investigate advocacy, litigation, and public education. So thank you so much for your time.
Thank you. Ms. Shillingford, Catholic Charities.
Thank you, Senator Francis, for initiating this conversation. And I sincerely hope that this conversation will continue and that there will be a lot more collaboration between the players to include both governmental and non-governmental agencies. And just to let you know, we spoke about the elderly. Catholic Charities does have a daily outreach to the elderly, shut-in elderly, and that allows us to have conversations with them daily to ensure, to verify where their mental state is, just to say, hi, how are you doing? Is everything okay? We provide them with meals daily, and it's really, disheartening when we think that there's so many elderly people, elderly shut-in, living alone, and many times the only people that some of them see for the day would be the Catholic Charities staff. So we do that. So if anybody knows of any elderly person who just needs that daily contact, you can call Catholic Charities. And we also, the VI Continuum of Care, I heard Mr. Stradiron talk about a directory. The VI Continuum of Care has already put together a directory of all the agencies, and so has the Community Foundation of the Virgin Islands that is available. So maybe NAMI can work with them to ensure, and that is maybe one of our issues, that there are too many people working independently. So maybe NAMI can work with the Community Foundation or the VI Continuum of Care. And I think NAMI already has an invitation to the table for the VI Continuum of Care, and we can all work together to ensure that that directory is put together well and out there to everybody.
Thank you, Ms. Shillingford. And VI Partners in Recovery.
Likewise, thank you, Senator Francis, for the invite and everyone that was a part of the conversation this evening. We were definitely shared and spoke about some topics that enlightened us as panelists and the community. And we here at the Village are definitely going to continue our part in the role that we play with substance abuse and mental health. We have the services of treatment that we offer with our treatment program here at number 1 Sign Hill, as far as substance abuse for men and women, adults. And we also have our prevention programs that are also in place that are there to assist our families and our young adults in the community. So our telephone numbers that we have on our treatment side, it's 719-9900. And for our prevention side, it's 718-3311. Thank you all very much.
Thank you.
Thank you very much. I want to say thank you to all of our panelists. We're certainly out of time, and if it's one thing that's clear, is that we need to have more conversation in respect to mental health, behavioral health, and developmental disability. Obviously, mental health is a taboo subject. A lot of times individuals are really reluctant to have that discussion. But I want to thank all of the panelists for their contribution this evening. I want to thank the viewers and certainly the providers that continue to go out there and put their best efforts forward. And I want to thank my staff for organizing and certainly getting this conversation off the ground. I want to thank media for assisting in being able to, again, broadcast via this medium. And certainly there is some next steps. We know that in our discussion, education is critical, awareness is critical, team effort and collaboration is critical in the conversation. I want to thank my colleagues that have joined on this evening as well. And I know that many of you still have questions, and I'm hoping that we could have a second segment of this in the very near future so that we could be able to hear from you, answer your questions, because we still have a lot of questions coming in, but nonetheless, we're out of time. So again, thank you very much for this conversation. I look forward to our continued dialogue as we continue to vet this important comprehensive reform and being able to address the quality of care and services to our mentally ill, behavioral health, and developmental disabilities act. Thank you very much. I pledge a very good evening to everyone. God bless.